Well, welcome, everybody. It's great to have you here for this latest installment in the Elspeth Rostow Distinguished Lecture Series for Public Policy Leadership. I don't think I need to tell this audience how much this series means to us. It's one of our small tributes to our great, beloved, and much missed Elspeth Rostow, and really reflects her own deep commitment to public service and to bringing to the life of this campus a broad perspective, not only from the policy challenges here in the United States, but around the world. And so we have tried to find in every way we can little ways to honor her memory and to find ways to bring her spirit back in events here at the LBJ School and at the LBJ Library. I'm also particularly pleased to have an event which is co-hosted by the Robert Strauss Center and our Center for Health and Social Policy. It's an extremely important and interesting partnership here that really reflects the spirit of what we've been trying to do here at the LBJ School in recent years, which is to recognize the fact that whatever the nature of the public policy challenge, that everything now needs to be seen in its global context, and that whatever the problem and however local it may seem, that without understanding the global context, we just can't come up with the innovative and effective solutions that we need. And this partnership between the Strauss Center and the Center for Health and Social Policy really reflects that. And we're also honored that part of the reason this was all able to happen was because of the return of our good friend and colleague Ben Sass, who's with us tonight in the spirit that Elspeth so much believed in. Ben, as you know, has been serving as Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services. And not only do I admire his service there, but it makes me nostalgic since I got my start at the federal level as a lowly special assistant in ASPE. It's such a long time ago that I will not say when it was. So it is a very special occasion, and we're particularly honored to have, and I'll revert to what I've always learned is the hierarchy of titles, which is to have Governor Levitt here, but also Secretary Levitt, the Secretary of HHS here tonight. As I say, it's really especially fitting in light of our effort to try to bring together this transnational perspective on our public policy challenges that we should have such a distinguished practitioner who in every aspect of his career has had to deal with these issues, not only now in HHS, as he's going to talk to us about tonight, but previously as administrator of the EPA, and even as governor, where he had many significant accomplishments, not least of which was hosting the Winter Olympics. And if ever there were a transnational challenge, that was one of them. I got to know then Governor Levitt a little bit after that. We served together on the Markle Foundation Task Force on Information and National Security following 9/11, and the perspectives of his own service and what he had to deal with in preparing for the Olympics, as well as the perspective of how important governors and local and state officials are in dealing with the challenges of terrorism and dealing with disasters and disaster prevention, was really enlightening, and he provided great leadership and insight on that panel. So it really is very much in the spirit of what we're trying to do in this lecture series and more broadly in the programs here at the LBJ School that I have the honor of welcoming Governor Secretary Michael Levitt.
Thank you, Dean, and thank you for allowing me to come and be part of this quite distinguished lecture series. This is the second very distinguished event I've done today. Early this morning, we kicked off an update of the Dietary Guidelines for the United States. I thought it was perfect that we would do it on the eve of Halloween. I had a conversation earlier today with my daughter, who is the parent of two of our grandchildren, and she was regaling me with the conversation they had about with her oldest son, who is now 3, about what he would be for Halloween. He originally wanted to be a dinosaur, very little boy-like, and his mother was pulling for a pumpkin, because I think she had the costume. There was apparently some debate about this going back and forth between them, and as they gave his morning bath, she reports that he bolted from the bathtub, went to his room, brought back his cowboy hat, and said, "I want to be a naked cowboy." I'm looking forward to the next installment of that. I have become a grandparent now of 5, which I have enjoyed very much. A friend of mine explained to me what it was that creates this common bond between grandparents and their grandchildren. He explained to me it was they have a common enemy. Now, some of you grandparents relate to that. I suspect it may have been that background as a father and also a grandfather now that an experience I want to begin by telling you today had some profound impact on me, as many have in the last 4 years. I was in New Delhi, and actually in the back alley of a place in New Delhi, a pretty tough neighborhood. I was holding a little boy who I would say would be about 18 months old, and I had tipped his head back like this and dropped 2 drops of polio vaccine into his mouth. His mother, who I would judge to be somewhere around late 20s, frankly about the age of my daughter, knelt down and held his head while I did it. Now, our circumstances could not have been more different. I am a cabinet member. I live in a very comfortable townhouse across the Potomac River from the nation's capital. She, on the other hand, lives in a hut with a blanket for a door and a dirt floor. But there was that moment when my eyes engaged with hers, and we communicated in a very direct and even-handed way. It was about a child and about a desire to protect that child. That was very similar to a similar meeting I had with a father. I was in Zanzibar, and we were all dressed up in clothing to go out and spray for mosquitoes his hollow concrete block wall and the sheet metal that covered his roof. It was an Islamic family, and as we shook hands, we just had that moment where you linger just a little bit longer than normal, and there was this expression of appreciation because his family would be protected from malaria. I've been in Africa and met victims of HIV/AIDS in distant villages where with their lips they can say the words USA, but with their eyes they're saying how much they appreciate what they're getting, because I know and they know that the antiviral medication that they're receiving that day in the clinic is preserving their life. There's 1.5 million people like that. I have seen the effect of the big, impressive hospital ships from our country that pull into ports all over the world. People come in the early morning hours, and they'll line up for blocks. They come hoping to leave with a new pair of glasses that you and I would take for granted, or without a toothache that's been torturing them for some time, from which they have had no relief. Or they come for more sophisticated surgery. I have seen people with grotesque hernias that have been not only debilitating to them physically, but had to be debilitating to them emotionally. I've seen the result of cataracts being lifted from people's eyes and people celebrating with a sense of just euphoria after what miracle it's brought in their lives. When those hospital ships roll into a port, there are tens of thousands of people who are served by them, but there are millions that know that ship is there. Our nation supports economic development. We support clean water projects. We support education. We do it all over the world. We do joint research. We do training for soldiers. We provide weapons. We provide food. We provide money. But there is nothing that is more powerful than what we do to minister to the health needs of people in need. Why? It's a very simple thing. It is because the language of health is heard in the heart. There is a connection. We are bound together as people. Whether we're rich or whether we're poor, we all feel this uncertainty with our own mortality and the desperation that comes with pain, and it links us together. You give a mother who is suffering with HIV/AIDS hope that she might be able to raise her children, and she will never forget. If you give a father the blessing of healing his child, his appreciation will never wane. If you give a teenager who's been disfigured the mobility of a wheelchair, and he will praise your name forever. I had a fascinating conversation this last week with Iraqi Prime Minister Maliki, who used a phrase I really like about this. He said, health is a good messenger of peace. In geopolitics, there is a constant struggle to win the hearts of people. Plays out in neighborhoods all over the world. The battle is about the struggle for the hearts of people, and in that battle, deeds clearly speak louder than anything else. And on that Richter scale that's in everybody's heart, the needle jiggles faster than anything else because of the language of health. Now, there's a lot of talk in foreign policy circles about the use of soft power and the use of hard power. And that's what I want to talk some about today. Hard power, obviously, is military or economic might. Soft power nudges a little more subtly. It's built through the accumulation of friendship and loyalties. Bob Gates, my colleague in the cabinet, the Secretary of Defense, recently told an audience, I want to read this to you. He said, in short, based on experience serving 7 presidents, and as a former director of the CIA, now and as Secretary of Defense, I'm here to make a case for strengthening our capacity to use soft power. Interesting, coming from a Secretary of Defense. He then went on to say, and for better integrating it into hard power. Now, tomorrow, if anybody asks you what it is that Mike Levitt talked about, I'm hoping that you'll remember 3 things. The first is that the Secretary of Health agrees with the Secretary of Defense about both the importance of hard power and the importance of soft power and the value of its integration. And second, I hope you'll remember that health diplomacy is very clearly the highest octane soft power fuel that's available. And last, I hope that we can talk some in our interaction about things I believe we could do better in order to meet our health diplomacy potential as a country. Now, I want to just make the case a little stronger about why health diplomacy is such a potent tool of foreign policy. You don't have to look any further, really, than to see how it is that the enemies of democracy use health diplomacy. In Lebanon, where the legitimate government there has tried to deliver health services but has just failed, Hezbollah, a political party that is devoted to terrorism, has used health by supplying medical needs and clinics and hospitals all through that region in order to legitimize themselves to the people. They know that war alone will not win the trust of people, so they have used health care as a means of being able to win their support. Early in the Iraq War, it became clear that Al-Qaeda was going to target the healthcare sector. The healthcare sector, they knew if they could take apart the healthcare sector, that they would have the ability to discredit this new government. I need to tell you that I've spent a good share of the last week in Iraq talking to small groups of doctors, and the stories they tell are just chilling. And frankly, it worked. If you go back to the mid-1990s, there were 35,000 roughly doctors in Iraq. 20,000 of them left the country. Since 2003 alone, there have been 8,000 physicians that have quit practicing. Why? Because of fear. 2,200 doctors have been killed. 250 of them have been kidnapped. It crippled institutions. It brought corruption and mismanagement. It took away the availability of health care, but most importantly to them, it discredited this new government and their capacity to deliver services. Same thing's been true in Afghanistan. Just two quick stories. When the United States wanted to support that same polio initiative I told you about in India that I had gone to see in New Delhi, the World Health Organization tried to get the president to Karzai to endorse the program. The health workers found out about it and said, please don't. If Taliban finds out that the government supports this at all, they will blow up our clinics and destroy our capacity to do this. I have a friend who works at the health ministry in Afghanistan. He was negotiating a deal to get a health worker released who had been kidnapped by the Taliban. He told me, I tried to persuade him on the basis of his cultural sensitivities, because the man had been an Islamic cleric. And he said, I said, this man comes from a good family. He said he's done nothing but to try to help people who are sick. He's not a soldier. He's not an official of the government. And the Taliban leader said to him, he brings credit to the government, and that's why we took him. And then he went on, incidentally, to threaten my friend with the same plight. There it is. Health is a legitimizer of governments and ideologies. You can look to our south, Fidel Castro. Castro he has little hard power, but he is a master at using health to create soft power. Commonly accepted estimates would put the number at about 40,000 doctors that Castro has trained and spread throughout the entire world. He built these medical schools. He trains doctors by the thousands, then he places them in underdeveloped countries. And they are doctors during the morning, and they are political organizers during the afternoon. Now, this is actually a very clever strategy. In terms of land and population, Cuba is about the size of Pennsylvania. It's got an economy that's smaller than the state of West Virginia, and yet these people punch big. They punch way bigger than their weight when it comes to health diplomacy. And the truth is they make money because he pays the doctors so little. Now, they're not really very well trained. But if you're a person in a village in remote Central America or in Africa, it's a lot better than what you have now, and you're grateful for it. Just like Hezbollah, he makes a real impact. I've met Cuban doctors in El Salvador, and Guatemala, and Honduras. I've been there in Nicaragua, Haiti, Mozambique. I was in Timbuktu. It exists. In Mali not long ago. I had a very interesting discussion with a group of Army Special Forces personnel who told me about teams that from Cuba that they had encountered in the most remote area of northern Mali. Why? It's where Al-Qaeda chooses to hide and to train. And they're there year-round. Recently, a Central American health minister said to me, look, we're dependent on Cuba to train our doctors. We just don't have any alternative right now. Now, that's a very bad thing for the United States, to have Central Americans in our neighborhood dependent upon Cuba. Hugo Chavez is doing the same thing. He's currently building a very large medical school, and he intends to flood the undeveloped world with doctors now from Venezuela. The fact is, there are a lot of democracies around the world that are really in test drive status. They're trying to figure out, this is a litmus test, can they actually depend on democracy to deliver the things that they need? And that's why people like Chavez and Castro are so interested in health. They use health to discredit the ideology of democracy and liberty. Just as a side note, we risk, I think, 30 years of progress in Central America that we've made in democracy. The Chavez and Morales in Bolivia are just a start. We're starting to see, we got Daniel Ortega in Nicaragua. You've got Mexico that came within 200,000 votes of electing the very left-leaning mayor of Mexico City. We've got elections coming up in El Salvador and in Panama this year. They have candidates that are leaning to the left, and you've got people playing in health in a big way, and it's health that these candidates are driving at. Now, the point I'm making is that health diplomacy is a very, very important part. It's a very important tool in health in our foreign policy. So I'd like to talk for a minute about another reason that we do health diplomacy. There's a lot of people who find the idea that we do health to benefit as being somehow abandoning the sincerity factor that we ought to have. They feel like we're giving up benevolence in order to get benefit. Well, the reality is there's a very hard equation that we deal with in global health, and that is we can't possibly help everyone do everything or respond to every need. And my suggestion is we do have to very strategically allocate our benevolence. The benefits, however, can go a long ways beyond just benevolence. We get benefit directly in the United States. The Dean and I were talking earlier about how the global economy and global health are now traveling companions. Infectious disease, for example. We've had 3 pandemics in the last 100 years. If we have another one, it'll be very good for us to have places all over the world where we can begin to find it. I might add that when I was head of the EPA, it became very clear to me that the health of the United States is very much affected by what goes on in a factory in China or a tailpipe in Mexico City, because you're probably breathing that puff of black smoke that comes out of a tailpipe in Los Angeles or in Maine, either one. Many of the fruits and vegetables that we now eat come from Central America. A lot of the medicines that we have are from China and India. Next month we're going to open 3 offices of the FDA in China. And the next month we're going to do 2 of them in India. In January we'll be opening them in Latin America. Now, this is not just about being good diplomatic citizens and helping them. This is about getting benefit. So my point is that not only does it help us diplomatically, it helps us. The last point I'd like to make about health diplomacy is this. It also benefits us strategically with our hard power. I was in Pakistan not too long ago, and I had a conversation with the Minister of Health there, a woman named Sherry Renman, who is also the Minister of Information, which I thought was interesting. I said, do you think that the people of Pakistan have any idea how much money and resources that the United States provides to Pakistan? She was just unequivocal in her response. No. She said, I know that because I didn't know, and I'm the Minister of Education as well as Health. Until recently, I had no idea the degree of aid that the United States gives. Then she went on to tell me something that I suspect most of us know intuitively. She said, it may not surprise you to know that the United States is not very popular in Pakistan. In fact, she said, less than 10% of the people here have a favorable impression of Pakistan. Now, they're very important allies of ours in the war on terror. But we're terribly unpopular right now for a lot of complex reasons, among them being the fact that we supported President Musharraf, who was deeply unpopular there. But nevertheless, they're important. She went on to say, however, there is one exception, she said. And that exception is in northern Pakistan, where the earthquakes happened. She said the people there have a very vivid memory of Chinook helicopters that came to their aid in their time of need, and more importantly, and they stayed. The American people have remained. I visited this region, and they're still digging out from the earthquake. I met health workers that we were training. I went to health centers we were building. 50% of the people in that area have a positive impression of the United States by comparison to 10% in the rest of the country. Now, is this just about being popular? Well, about a week after I left, I noticed in the paper that the United States and NATO forces had gone into Pakistan in order to pursue a high-ranking al-Qaeda leader. Now, it was bound to be controversial with our critics inside Pakistan. I thought to myself, I'll bet it wasn't as controversial in the area where the earthquake struck. Why? Because we have done some things to develop trust with them, whereas in the rest of the country we haven't. I think it was it Mary Poppins who sang, "A spoonful of sugar makes the medicine go down"? There are times, just like Secretary Gates said, when we have to use hard power, but if we integrate it closely with soft power, there is a benefit to our benevolence. Now, I want to open up a conversation today about this, and I would like to talk some in the context of that with things that we can do better. Because I want to make this point to open this conversation. If you take all of the things that the United States of America does in health, it would amaze you. In the last 7 years, we have increased our spending on health diplomacy by 7-fold. In the next 5 years, we'll spend 7 times as much on global health as we did prior to the Bush administration. Much of this is involving the President's PEPFAR initiative on AIDS, the President's malaria initiative, and so forth. But that's only part of the picture. If you were to couple all that we do as a government at the Department of Defense, at HHS, at EPA, at Agriculture, and all of the places we do with health and related diplomacy, we are clearly the most humanitarianly generous people in the history of mankind. But no one knows that. In fact, it's been my observation that many of the people who get our assistance don't know that it's the United States. And as we get into the questions and answers, I'd like to tell you why I think that is, and I'd also like to discuss some what we can do about it and what I think the next president could do to build on what I think is a powerful opportunity to build health diplomacy and to benefit from our benevolence. Dean? All right. That'd be great.
Thank you for that terrific set of remarks. I have to say that listening to you describe your travels, if somebody hadn't heard the introduction, they might have thought the Secretary of State was here. And I mean that as a compliment. And I think it's really a powerful testament to how important it is to see challenges, and to see how many different aspects of American power, resources, capabilities need to be brought to bear to deal with our challenges. Let me start the discussion. Like I said, it was a really very candid and very direct exposition about some of the opportunities for us here. And I wonder, as you think about what you call strategic benevolence, I think it's a great expression, how we think about how what we do fits in more broadly with the global agenda. I'm sure, I know, in your work, you deal a lot with the international organizations, with the WHO and others. How do we fit our agenda setting on these issues with the global agenda setting in terms of setting priorities, setting policy, and how does the national decision-making fit with this more global environment?
Well, I think your point about my job is a very good place to start this conversation. If you were to ask me what is the most significant surprise I have had as Secretary, I would say it is the amount of time I have to spend outside the United States in order to keep people inside the United States healthy. Why have I been doing this? Well, one of the responsibilities I have is to prepare America for a pandemic. I mentioned that. You can't do that sitting here, because it's most likely going to happen in Thailand or Vietnam or Turkey or Egypt or some other part of the country, or world rather, and for us to protect ourselves here, we have to make certain that we have outposts and that there are public health strengths being built there that we can build on. And we've seen that work already, where we have discovered early certain diseases that because we had those assets. Another part of my job is in the import safety. I mentioned food and drugs. I'm spending a lot of time. I'll be in China twice between now and the 21st of January because we're opening these offices in India. This is just not. This is a necessity now for my job. But that's true in every part of our government now. I had a conversation with with people about the pandemic planning we've been doing, and we began to think about what would happen if there was an infectious disease in China and if it suddenly shut down the supply chain in China. What would that do to the U.S. economy? It's all connected. When I started into the import safety, the President asked me to do, we were talking about this earlier, the President asked me to chair a working group on the safety of imports. And our first task was to determine who had an equity in the issue. There were 12 departments and 2 agencies that had to sit at the table because they all had an equity. So it's all connected. And strategically, if we don't think now about this globally, we'll make mistakes and we will disadvantage ourselves. Now, one of the things that I've come to understand is that these problems look different from whatever vantage point you're looking at them. If you are dealing with the problem of import safety, it looks a lot different if you are in the Homeland Security business than if you're in the health business. It looks a lot different if you're a trade negotiator. It looks a lot different if you're the Department of State. And so one of the things we all have to learn is how to take not just our perspective, but the perspective of a number of different organizations within a government or a society. Not to go too long with this, but let me just make one other point. A very interesting thing happened with the most recent melamine crisis on milk in China. I had this very direct and frank conversation with the Chinese health minister, who said, here's what happened, and did his best to outline it. And he said, look, when we get together to do this opening of your office, do you think we could have a meeting about the way you did this inter-agency task force, because we need to learn to do that here. This is China. I just suggest to you that the world is beginning to intuitively organize itself into networks. And we're all learning how to manage that. And it's a global interconnected network. And that's why it matters.
But talk a little bit about, you mentioned PEPFAR. There's been a lot of discussion about how we approach AIDS versus others. I mean, how do we work with not just the other countries, but sort of trying to create these global alliances where different countries have different perspectives about what the priorities are? How does the United States fit into that?
Well, one of the things that I believe we need to do as a country is we have to coordinate better both within our government and with others. One of the things that we have done in PEPFAR that I think is very smart is to recognize that a lot of the expertise to manage this program doesn't exist at USAID, which has typically been the provider of most of the aid. We have people at the Centers for Disease Control who know a lot about this. We have people at the Food and Drug Administration who know a lot about this. We have people at the Department of Agriculture who in their work are starting. So the Congress, I think, wisely created a system of the Global AIDS Coordinator, which they essentially have report directly to the President and have given extraordinary powers to work out conflicts both in budget and in priorities. And the Global AIDS Coordinator now takes resources from each of the department and coordinates them in a collaborative way. And now we're doing the same thing in host countries. We won't give aid to a country unless they have a system to coordinate within their country among NGOs, among the government itself, and among other governments who are now participating in this resources. This is a very important 21st century skill. It's complex problem solving through collaboration. It's not something we have done well in the past, and it will be a defining feature in my mind of the prosperous society of the future.
So you're thinking about problems like global food safety, global health standards and the like. We've been thinking about this in the economic context about economic regulation. How do you make sure that that banks or the other financial institutions are meeting standards? What kind of framework can you build to persuade other countries that they need to come up to the kind of standards that we're talking about? How much of it is, can we do it through incentives, inducement? What's the strategy? We don't have a global government. We're not going to have a global government. How do you get these kind of core standards where what other people do affects us so much and get them to accept the idea of doing that?
Well, let me tell you a story. Again, this one in India. I went out one morning and we went to a farm where they were growing chili peppers. And I saw on a bag, a brown burlap bag, a yellow cloth tag that had been hand sewn to the bag. And on it, written in handwriting, were words I couldn't read. So I asked, what does this say? And they said, well, it's the name of the farmer, it's the day it was picked, and the location it was picked. It was traceability information. Now, I was fascinated by that. Why? Because in India, no one has more political clout than the small farmer. They organize and they vote. And if you're in politics in India, nobody messes with the small farmer. So I said, almost knowing the answer, I said, so did the government make this a requirement? Oh no, they said it was the processing plant. Well, that day I went to the processing plant, and it was owned by McCormick Spices and another local company. And I said to the manager, I saw this bag out there. Had this. They say you made him do it. He said, well, it is now a requirement of doing business with us. And I said, well, why did you do it? Well, he said, our customer said if you want space on our shelf, your product needs to define the traceability information. And so we went to the farmers and said, look, we want to buy your chili peppers, but we can't do it unless you got this information, and we'll help you learn how to do it. And they did. Now, I call that the red pepper principle. It's basically, you can, with a market force, do many things you can't with a government mandate. That never could have happened in India unless Walmart or some other major retailer had said, we're going to require this or we'll get the chili peppers somewhere else. What we're learning is that government is an important player, but we are but we're a coordinator and not necessarily the enforcer of everything. And that the marketplace, through big purchasing power, may in fact be the best way for us to begin to shape global standards.
One last one for me. You talked about your task force and the 12 agencies. When we were in the government, we began the process of trying to bring HHS into the NSC. We had Dr. Ken Bernard came over from HHS, sat with us over at the NSC. What's it like now? I mean, when you walk into the NSC, are you now seen as a full partner? How well integrated are your efforts? How well is your voice able to participate in the day-to-day decision making, so that when people are thinking about our relations with Indonesia or Vietnam, that those kinds of concerns that you talked about get represented in this?
I don't think that they have the full picture of how much influence health has, and I think they academically understand it, but it's a different culture, and frankly, HHS has evolved over the last 5 years in many ways. When I came to HHS, we regulate a lot of health things, we finance a lot of health things, we do a lot of medical research, but in the last 4 years, it's very much become part of the Homeland Security part of our government, and also the National Security Council world. I don't think we have yet emerged as full players, but I will tell you this: when we go to China for the strategic economic dialogue, frankly, health has been the place we've produced the most means of being able to connect. And we're always at that table, and we're always at the Homeland Security table, but we're having to sort of push our way into the national security discussion.
Well, let's turn to the audience. I see mic stands, but I'm not sure whether we have mics. Do we have mics? Yes, we have mics. So why don't you, are you going to pass them around, or do you want people to come up to the mics?
We can pass them around.
Okay, so let's do that so you don't have to wander up to the stands, and the floor is open.
Who wants to start?
Okay. Right here. Let's start right here. This is, Governor, I don't know if you know Ken Shine, the acting chancellor of the UT system and a great friend of the LBJ school.
Oh, thanks. Thanks, Secretary. Great to have you here.
Nice to see you again.
One observation and a thought that I would run by you. One observation with regard to this last discussion about NSC is that I've had the privilege of chairing meetings, for example, in Bellagio and Nice with Iranian health people and scientists, Americans and French and so forth. We hold them in Bellagio and Nice because we can't get them into this country. And I think, given the importance that you place on health diplomacy, helping the State Department to understand these are not terrorists. I mean, they include the president of the National Academy of Sciences of Iran. And granted, we have our differences with Iran for many reasons. The fact is that these are educated, open, in many cases, data-driven people that I think communications with have been very valuable. So your role in getting health diplomacy to be reflected in diplomacy in this regard could be very valuable. The thought I had, and that was...
Did I comment on that before?
Sure,
you
absolutely.
Go on? You won't forget your other thought? I am very aware of this because we have similar experiences, but I think it makes your comment makes the point that all of these issues look different based on where you stand. It's actually not state. They would badly like to have those people come and be able to begin diplomatic ties with the United States. It's the Department of Homeland Security, which is in Department of who controls that process, and so it's the problem of being able to get two departments who have different missions to look at things in common, to take the global view. Excuse me.
No, your point's well taken, and I acknowledge that DHS has had a lot to do with a number of these things. I was struck by the fact that in this country we have a major problem with primary care. We need to encourage more young people to go into primary care. That many of our students across the state and the country like to go to foreign countries to have rotations, but to spend a lengthy time there doing primary care when you've got a debt of $120,000 is a real challenge. The thought I had was we do have loan programs in this country for service in underserved places in this country. Question is, should we consider broadening that so that some of the strategies that you described from Cuba could be played out with our young people who would be, on the one hand, as a result of a loan repayment program, in part, given a bigger opportunity to work overseas, and secondly, because they have a good experience with primary care, might come back to this country and practice primary care as opposed to specialty care. And I just wondered what your thoughts might be on some strategy like that.
Well, you tempt me to get into the illogic and the hurtfulness economically of our medical reimbursement system. But you make a great point that is at the heart of it, and that is we don't incentivize people to be in primary care because we don't pay them well. We just pay the specialties on a piecemeal basis, and you can make a lot of money if you're in that business and do a lot of things. It probably won't surprise you to find that there are that 27% of the primary care physicians in our country were trained in medical schools outside the United States. So the problem you point to is bigger than just being able to send people. We can't keep them here, let alone supply them outside. But you're dead on with respect to what has to be done. We've got to fix the reimbursement system so that we begin to incentivize people, and we could get primary care, and maybe we could then begin to send people outside the United States. That's good. Thank you.
Thank you, Mr. Secretary. That was a fascinating presentation. I was really struck by your comments about the interconnectedness and the rise of these networks, and how everything was all interconnected. I wonder if you could give your view of the state of the kind of global institutional architecture, the global governance issues that both the United States and the world are going to face dealing with these complex global issues, whether you feel. It sounds in your description that it's more informal than formal, but what you see is the state of this global governance, global institutional architecture, and what you think needs to be done over the next 5, 10, 15 years to improve this coordination, to sort of what kind of institutional measures might be necessary?
Well, let me just reflect on our relationship with China and the way I've seen it evolve over the last couple of years. The Secretary of Treasury, Hank Paulson, had spent an enormous amount of time in China. So when he became Secretary, he initiated what he referred to, what we now refer to as the Strategic Economic Dialogue. When we were in the early stages of that, that's when we started having these product problems. And they happened to be in the United States. When you'll recall the dog food, the melamine in the dog food, which, by the way, produced more calls to FDA than anything in history. You can have cough syrup problems with your children, but if you do something with the dog food, you're going to get more calls than anything else. We had a very frank meeting with the Chinese ministers who were in town, and I said to them, I just don't think you're giving this. Every conversation at first started off, if you could just control your media and get control of your Congress, none of this would have happened. But, I said to them, this is the Made in China brand. This isn't about dog food. It's about the Made in China brand. Well, frankly, the Chinese now get that. And we now spend twice a year, 2.5 days, sitting at a table talking to each other about the way things work in our society and theirs. And through the course of that time, we've now done it for, I think I'm going in December, I think this will be the 5th or the 6th time. We go back and forth. It's a home-and-home deal. It's an enormous amount of time and a lot of effort, but we have built relationships. To the point that I can now pick up the telephone and call the Minister of Health in China, and he will tell me with candor the nature of the problem he's dealing with, because we've begun to develop a sense of trust. We went through a very rigorous negotiation over agreements on food and how we would manage the different systems that they have and what we have. If they wanted to have products in our country, they needed to meet our standards. If they were going to meet our standards, they needed to know what they were. And we began to work back and forth on this. We negotiated an agreement. We're now opening offices there. We've told them they're happy to open offices here. What I want to tell you is two different systems, entirely different. But we've now begun to define what the goal is and recognize we've got to become interoperable with different systems. And if I can understand their system, while I may not agree with it, and they may not like the way our Congress works and our news media, it's the way they have to work, and we've begun to build those relationships. I guess the point I'm making is it really is relationship-driven in my view, because we're not going to change their system. We're going to learn to achieve interoperability with different systems. Now, at the heart of that is the process of defining standards. If we had this conversation, we would use that phrase over and over and over again. The future in this networked world is the defining of standards. Now, this is a hard job because everyone now wants to be in the place of defining the standards. But I won't go. If you're interested in talking more about standard development and what I'm seeing in that area, I'd be happy to. But I think it's standards and relationships and markets. Those are the three things that are defining the frontier on this point.
I'm wondering about, thank you, Mr. Secretary, for being here tonight. I wanted to see if you might comment on what, you talked a lot about our efforts in China and the Middle East, Afghanistan and Iraq. What kind of similar relationships are we needing to forge in Latin America, in Cuba? You indicated some concern in terms of what's happening electorally in some of those countries, and what, in terms of health diplomacy, what might we do to gain a foothold there?
Let me give you another example. I've developed this quite uncharacteristic, I guess you'd say, or surprising relationship with Daniel Ortega. Now, when I was in high school, if you had told me, first of all, that Daniel Ortega would be the elected president of Nicaragua, I would have been surprised. I'd been quite surprised if you'd said, well, I'll be attending his inauguration with he and Hugo Chavez. I would be even more surprised if you told me, well, the day will come when you and Daniel Ortega will drive around together in his Jeep to look at Lake Managua. But all of that's happened. And here's the way it came about. I started interacting with him on various points related to health. He knew I'd been at EPA. I told him, look, the U.S. really started to make progress on health when we started cleaning up our water. And he knew that his people are unhappy about the quality of their water, and with reason. So I said to him, Mr. President, I know a lot of people at the EPA. We do some things in our department. Would you like me to bring some folks down? We could maybe get together with the folks in your civil society and your government, and we could begin to work at the problem of Lake Managua. He said, oh, if you'd do that, that would be great. And so I took a team down, and we took one night, we went out to a hospital. I mean, literally, he drives me. I'm his passenger, he's the driver. And we go to a hospital, and the next morning we get up and go to Lake Managua, and we go around the shores of the lake. And first of all, I thought, this is really a great diplomatic moment. I'm there in Daniel Ortega's face as the United States of America, helping him solve a problem that is important to him and his people. We're forming a relationship that will help me solve other problems with him if I need to. And here's the kicker. Here's the benefit beyond the diplomatic in our benevolence. That water goes on fruit that gets sold in U.S. stores. And 2 weeks before I did that, we did an import alert on cantaloupe from Honduras because of bad water. So I'm helping to develop a diplomatic relationship with Daniel Ortega, who is very much on the border between his socialist comrades and trying to become somewhat of a diplomatic, or of a artist of democracy. And there's a big win here. Why? Because of health diplomacy. We are benefiting from our benevolence, and we're staying in touch and building a relationship. I'll give you another example. I went down to Central America to work on pandemic influenza. I met with the health ministers. They were all talking about skilled health workers. They can't get skilled work. Now we're not talking about doctors and nurses. We're talking about lab technicians and equipment repair people, and we're talking about birth attendants and people who can do just basic public health. They were talking about doing something together. At the lunch break, I said to a couple of them at my table, you know, if you decide you want to do something together about this skilled medical training thing, that just seems like a great place for the United States to help. Why don't we put together a business plan of some sort that could put that thing together? Now, that was in June. In September, they all came to the United States. I had them all over, and we had framed up with them a business plan on what a training center could be that would take all of the Central American countries and help them work together, and we would be kind of the shadow support for it. In December, we signed an MOU. I went to each of the heads of state. They signed on to it. We made a big thing out of it. We now have a training center in Panama that trains health workers in all 6 of those areas. They bring people in, hopefully, in the future by the hundreds. They'll be trained. They'll get a little bit of orientation on the beauties of not just health, but democratic government. And they'll go back to villages and do essentially the same thing that we talked about earlier. I think that kind of thing is what we need to do more of in Central America.
Thank you for being here. You've talked a lot about the networks, but so far, aside from one mention of NGOs, I've heard networks of country with country, and it seems like there's some other very important actors there, NGOs being one. But what I'd like to hear you talk about is corporations, particularly transnational pharmaceutical companies, and how have you related to them with relation to drug prices and patent laws and bringing down those drug prices for people who really need them.
This is a very difficult issue that has to be dealt with because it's at the heart of what a lot of underdeveloped countries want. They need medicine, they need access to vaccines, and we're seeing this play out right now in the area of sample sharing on infectious disease. There are a couple of countries who are saying, I know the world's been sharing viruses for the last 60 years, but we think we now want to keep ours. And we want to keep them because we think there's intellectual property there. And we want to have a royalty on any vaccine that's made out of a virus that would come out of our area. We can take more time and talk about that, but the potential of that unraveling 60 years of public health success is very high. And at the root of it is a desire to get medication and vaccines at a price that they can afford. They have much different views based on where they sit on intellectual property. We try to make the case that many of the things they want access to would not exist if we didn't have intellectual property laws, etc. But we've begun to work with pharmaceutical companies to begin to work with them in ways that will license their technology and acknowledge the fact that it is their technology, and then help them get it so they can produce the medications at a lesser price. This is a big subject, but I hope that's responsive. I will tell you this, that it's not just underdeveloped countries. I was in France a couple of months ago, and I was invited there by the pharmaceutical industry. And this is a long story. I'll try to make short. And basically, I said to them, there's a lot of people who'd like the government in the United States to negotiate for pharmaceutical prices in the way you do. The way that Europeans do it, they say, if you want to be on our formulary, you'll take all of the return on investment out of your price and you'll give it to us at 10 cents. Whereas in the United States, we're paying $1. I said to them, you have a big stake in this, because if we adopt the same strategy that you use in the United States, that is a road to a world without innovation. Because right now, the R&D budget for the European Union and most of the socialized systems there is the same budget we have in the United States. We pay our share and their share. So this is a big issue. And in my mind, it's as much a trade issue as it is a health diplomacy issue. Again, it just points out that it's all connected, and it just depends on where you stand and your perspective as to how you see them.
One more question? Okay.
Thank you, Mr. Secretary, for being here. I'd like to bring up a specific challenge in health around the world with the disease tuberculosis, and how is the U.S. approaching that in order not only to protect itself from the spread of disease here, but to help countries who have huge numbers of cases and people dying with it every day, and the drug-resistant strains of it developing?
This is a matter that the Center for Disease Control and Prevention spends a great deal of time both working on and worrying about. It has not yet risen to the point that we have a major initiative, though there was money appropriated in the authorization, the 5-year authorization for malaria and AIDS to look at to work on tuberculosis and another of other rare diseases. So I guess I just want to acknowledge what you say is right. We are working on it in a number of places. In some places, as very close to this border. We work a great deal with the Border Commission between the U.S. and Mexico on this matter. But it has not yet raised to the point of having a major initiative like we have AIDS and malaria.
Secretary, given that the election is only 5 days away, I can't let you get off the stage without inviting you to give your 5-minute version of what your advice would be to the next president in dealing with these issues and what you think the priorities and the appealing strategies are going forward.
Let's just acknowledge that in the area of health, I mean, it's fairly vogue these days to be critical of the current president. But I believe that George Bush in history will be seen as bold, noble, and visionary on global health. I don't think there's ever been a president who has stepped up in specific categories of disease and led not just with U.S. resources but internationally. Now, I admire that, and I'm glad he's done it. I would say that there will be a tendency on the part of some it would be a natural tendency to say, well, that was Bush's thing. I'm not going to do that. I think that's the wrong approach for the next president. I think the next president ought to do the following things. One, he ought to take PEPFAR, the AIDS initiative, the malaria initiative. He ought to go take everything else that goes on at HHS, the Department of Defense, EPA, and he ought to go to universities, and he ought to go to corporations, and he ought to go to nonprofit organizations and faith-based organizations and individuals who are working outside the country, and he ought to tie a great big bow around all of it. And he ought to say, this is the generosity of the American people. And the first thing the next president needs to do is rebrand what we do in the United States. I indicated earlier we do a lousy job at telling our own story. And part of the reason is because if you go out anywhere in the world, you can find a brochure and printed material that will have 6 different seals of the United States government with 6 different agencies who have been squabbling about who's going to get the credit. And it's probably on the back of a brochure that's headlining an NGO that is getting the credit. So the first thing is he's got to wrap a bow around it. He needs to rebrand everything to where it's all speaking with a single voice. We ought to adopt the USAID words of "from the American people," and we ought to start telling our story better. I mean, We need to build more coordination into it. I've got a long list of things, and our time is up, so I'll send you an email.
Excellent, excellent. And I'll share it with everybody in the room, and maybe with the next administration. So, Mr. Secretary, thank you so much for being here. It's been a great evening, and we really appreciate your time.